Good afternoon, ladies and gentlemen. Once again, thank you for joining us this afternoon for today's webinar. Today, we have with us three companies from Mentor Media, VP Medical Packaging, and VC999. So before we begin, I just have a few quick housekeeping announcements. We are taking questions for today's webinar. So if you do have any questions for our speakers, please feel free to submit them via the Q&A button at the bottom of your screen. With that, I shall hand over to Loy. Mr. Loy, please. Loy, your microphone is not on.
Good morning and good afternoon and good morning to some of us. All right. So we would like to introduce ourselves today. We are doing this technical presentation as an alliance. My name is Loy, Deputy Director, Sales and Marketing for Mentor Media Limited, and I have the honor with me, Dr. Andrea Brands, Head of Business Unit, Medical Packaging for VP, and Mr. Ura, CEO for VC999 Medical Packaging. So as we understand how the pandemic has changed the way we live our lives, and also given the fact that EU MDR has also been gradually adopted by global companies. So today, we are very honored to share with all of you the solutions that we have derived as an alliance. Okay, delivering sterile packaged medical devices has always been the core aspect of a standard quality for the benefit of patient safety. Hence, we strive to provide an integrated solutions from an alliance level. Without further delay, let us just go through our capabilities and what we can do for customers today in the medical industry. I'm sure all of you can see my screen today. All right, so we are Mentor Media, member of Elanders Group. Elanders Group is a traditional 100-year-old print and packaging company deriving from Sweden. We are 7,000 employees in 20 countries, 3,000 customers in 30 over countries, and 1.24 billion in annual sales. We have been in Stockholm Stock Exchange since 1989. Okay, ever since the acquisition of supply chain companies, namely like Mentor Media, LGI, and Virgin Logistics, the business actually takes up 80% of the whole group itself, which makes us the majority holder of business lines in supply chain solutions. And 20% remains print and packaging as their traditional business. So our integrated offer as a solution company itself, as a global supply chain company, we offer an integrated solution ranging from your unique business, basically in purchasing, procurement, warehousing, distribution, print and packaging. Last but not least, these are all the solutions that we have always been giving in the IT industry, some 30 years back, even until now. And then we think to ourselves, hey, we are already at the best of what we are doing in this business. What's next? And then we look at inwards at what we can do for the medical industry. And here we are. These are the locations of Mentor Media. We are basically covered as a matter of worldwide. The two white dots that you can actually see are Singapore HQ as well as Indiana. Indiana is in the pipeline. We are in development and it will be operationally ready in 2023. It will comprise of the same solutions as what you see in Asia Pac Singapore HQ, ISO Class 7 Cleanroom, cleaning, sterile packaging, assembly, and supply chain solutions. So some of the timelines that the Indiana site will be ready in 2023. The site readiness will be August 2023, and ISO 13485 certification audit completion will be in September 2023. And we strive to be operationally ready for clients' engagement in October 2023. So in Asia Pac, right now, we have a clean room within our own facility itself. The capacity we can actually hold is about 4 million pieces per year. Floor space, approximately 2,500 square feet. In Indiana, as we mentioned in the pipeline, projected capacity will be up to 10 million pieces per year. Floor space, 20,000 to 30,000 square feet. And last but not least, we look at Europe, which is in the pipeline. So when we look at solutions, providing solutions to medical industry, we will always ask, why Mentor Media? All right. So in a snapshot, standardized pouches, we are using standardized pouches, standardized equipment, synchronized process and validation throughout the whole process, which is to say whatever we are using in Singapore right now in our clean room, we are going to mirror it the same in Indiana and in the pipeline to other regions where we have our sites. JIT production, which is very important for us because it saves time and it in fact brings seamless transition to customers' business today, leveraging on our global sites. So we pride ourselves always as a single desk solutions, medical solutions provider. Okay, but what do we mean by that? One-stop service for all your industrial and commercial needs, from sourcing right down to VAS, value-added services, such as hospital inventory management, RFID, kit management, and not forgetting the essence of today's presentation, sterile packaging in an ISO Class 7 clean room. So the ISO Class 7 clean room is the latest addition to our site of facilities within the 200,000 square feet of floor space in the western side of Singapore for the benefit of those who are not in Singapore. QMS certified that holds the capabilities of cleaning, assembly, pouching, sealing, packaging, all in a clean room with high-speed machineries in complement to our alliance partner, BC999. We use pouches with a validated shelf life of up to 10 years, again by our prestigious alliance partner, BP Medical Packaging, where later on Dr. Brents will share more. So this is our warehouse and distribution facility, generic business that we have been doing, 3PL solutions for medical companies. GDP-MDS, for some who are not familiar with Singapore, this is actually a certification that allows you to hold, store, and manage medical devices. ISO 13485 certified, which is a more international storage requirement. All right. Environment controlled storage of medical devices. Right now, today in our facility, cardiology, endoscopy, urology, and diagnostic equipment are what we store day to day. Controlled environment in loaner management, consignment inventory management, fulfillment to medical facilities such as hospital, medical institutes, and so much so forth. And we adopt full product traceability in our warehouse itself. As we expand our network with major medical brand owners, there are a lot of grievances and pain points that were shared with us through them. The reason why is because they have been always going into, or rather sending their products into hospitals, into medical institutes, into laboratories. Okay, missing inventories in medical institutes has always stick out like a sore thumb. And of course, RFID, as what you see in this slide, is nothing new. It's not rocket science, but we actually utilize it for the benefit of our clients today in a foreign site that track items, follow milestones, and of course manage FEFO. So this solution is actually developed by our end. Hardware, of course, it's off the rack, off the market, but the solutions, the technology are all inbuilt by ourselves. And it actually serves the diverse needs of brand owners in different environments, such as hospital, consignment stores, and so much so forth. So our mission statement is always at delivering best-in-class sterile packaging and supply chain solutions for the medical industry, medical device industry, with the goal of patient safety. And we work on all these 5 pillars, which I'll share more. So first is easy, single point of contact to complete services. Like I mentioned earlier in the deck, the single desk medical solutions provider, right? Warehousing, manufacturing, as well as conformity and safety, which is the essence of our sterile packaging services today. And all these solutions can actually be mirrored to global sites. So next, time to market. Already a validated process that includes the machine and packaging material as well as their validation, where customers can quickly adopt for the benefit of a flexible and cost efficiency solution. This is what we call, again, single dash solution. Okay, so Mentor Media can actually manage from point A to point B, and even right up to handshaking with your sterilization partners, or even with our own contract with our sterilization partners. Again, the validated shelf life for Tyvek, PAP, paper foil is up to 10 years. So this validated process does give you a very solid foundation for meeting the requirements of ISO, FDA, and the new MDR, EU MDR. So now whatever we have done here is already considered what we consider a completed process, where we can replicate this in any sites that we move to, or rather any sites or setup that the customers require us to be in. So without having the need to reinvent the wheels and go through the same validation again, in short, this is easily mirrored. Similarly, this is what we are going to do for our upcoming Indiana site. So as we are under the Elanders group, leveraging on the group's global site, there will definitely be a location near a business where we can support. This leads to ultimately saving a lot of freight costs, unnecessary touch points, as well as reducing the damage to sterile products, medical device, and then minimizing transfer within regions. Serve as a VCP for customers globally. So our solutions are all in compliance with EU MDR, ISO, and regulated in accordance to international standards. So we have a team of internal QA and a consultant with over more than 30 years of experience to govern all the processes that duly fits the requirement of customers today. So today we are delivering an integrated solution, and what our customers say about us. We are actually a one-stop consultation and solutions company. Continuously, we improve and improvise with innovation with the use of technology, helping the customers meet international standards and provide a product safe to use for our patients today. And now let me pass the presentation to Uriel of VC999, our alliance partner. Uriel, over to you.
Thank you, Lloyd. Good morning to everybody, also from my side. Happy to be here, and thank you very much for your attention and the opportunity to briefly introduce VC999 packaging systems. My name is Uriel Inauen. I am the Group CEO of VC999 Packaging Systems and also the CEO of VC999 Medical. VC999 Medical is a business unit of VC999 Packaging Systems. Further down the presentation, I will use VC999 just for the ease of it. As it says here, VC999 Medical is your leading packaging process partner. This word or the expression packaging process actually is the key message. I'll talk about this in a second a bit more in details, but let me first introduce briefly our company. We have been founded more than 50 years ago. We built packaging machines since more than 50 years, mainly focused on chamber machines and thermoformers. VC999 is a Swiss company. We manufacture, produce our machines here in Switzerland at the headquarters and also in our sort of second headquarters in the United States. The company is still family owned. It's owned by my parents and myself. My parents started it, and let's say I took it over in the second generation. We are specialized in medical packaging. We built or manufactured the first machines in the early 80s, so quite some time ago. We have, I'd say, some extensive experience in building capital equipment and all that comes along with it. That starts with the designing. We design the machine in-house in our own design department. We produce, well, to a certain extent, of course, the key parts in-house. distribution, of course, sales, marketing, we control ourselves. Also consulting, that's usually before a sale, very important, but also after sales, qualification, maintenance, after sales. As you know, capital equipment has a long-lasting time period, and so we make sure also with our presence globally to maintain and support our customers with their equipment. As I mentioned, we built the first medical packaging machine already in the early 80s, but since the MDR, the medical device regulation in Europe, came across, we went even a step further. We decided to actually even certify ourselves according to ISO 13485. I want to mention or stress out that as the packaging machine itself is not a medical good, so we would not need a certification according to ISO 13485. And as far as I know, we are actually the only packaging machine company or manufacturer having that certification. But for us, that was very important also to show towards our potential customers that we understand their needs, that we talk their language, that we know what the requirements are from a regulatory perspective. And as you probably all know, it is also good for an organization to have time to time external auditors. So that helps and made us a fit for the new requirements from deriving from the MDR. With the MDR, cleaning and packaging became a critical part of the product. And this, of course, has an influence on the machines and the validation of the machines or the process. About the process, again, before I come into the process, as a machine manufacturer, I want to first keep on talking a bit about the machines as there is our passion. Lloyd, can I have the next slide, please? Well, this is our, well, one back quickly, our local, our global presence, as you can see here. We see actually or feel that Asia is the growing market in terms of medical device market for us, with the strongest growth. So that's actually one of the reasons, the main reasons we teamed up with Mentor Media in order to be faster, a presence where our potential customers are and where our solution is needed. So Asia is in our focus for the future. Now let me quickly introduce the machines. Lloyd, the next slide, please. This is our C6 medical chamber machine. A chamber machine, as you can see here, actually it's called a chamber machine because you have a lid that's open here with a light inside that closes and then forming actually a chamber, and then the process starts in that chamber. We can evacuate that chamber, change the atmosphere, for example, gas flush with nitrogen if your product needs that, or we just seal only, we just close the bag if you don't need a vacuum. But by the way, if you use a PE material and you're able to pull a vacuum, the device in the bag actually stays in its place, so it does not move around. If you have some, say, for example, in afterwards in the transport validation, makes it a lot easier if you have it properly packed. That's what this machine is doing. It's equipped with a high-speed, high-performance vacuum pump. Of course, this pump sits not in the machine. It will be mounted outside the clean room, easily connected. It can be easily up to 20 meters away, so you don't have any, I would say, grease, oil, or machine in a clean room. We even gather, we need some compressed air to run that machine. We even gather the exhaust of that compressed air and pull it out of the clean room. So this machine will not cause any contamination in the clean room, and also none of the turbulences caused typically by compressed air. Of course, this machine meets all international medical technology standards, like in Europe, the MDR, the Medical Device Regulation, or in the USA, the FDA norms, or the ISO norms. The machine operates in very narrow tolerances. The three main points, even also in validation of a packaging, is the temperature of the sealing process, the time of the sealing process, and the sealing force applied. And if applied some vacuum, a changing of atmosphere, of course, the pressure. All these parameters are constantly monitored during a sealing process. So if one of these values goes out of the tolerance, the machine flashes, stops. Every operator knows right away there is something wrong. I have to check, I have to change something. For example, sealing temperature, which is very critical, we operate within ±3 degrees Celsius, which is very narrow on the whole range between 100 degrees Celsius and 200 degrees Celsius. On all three seal bars, you might see that on this picture, it's like a U shape. So in the front, you have a long bar and 2 bars on the side. You can load that machine up with several packs. So it's not what a lot of people are used to, have a single packaging like in a rotary sealing or a tabletop kind of machine where you do a single pack per cycle. Here you can load, for example, if you have narrow bags with 50mm wide bags, you can load up to 18 pieces per cycle. And the machine is capable of doing easily 2 cycles a minute, so you can calculate. So it's quite a workload you do with that machine. Every cycle it makes you several packages. Of course, you can also put in big bags, big products in order to use the chamber size. There are filler plates in there in order to make it higher if you have a high product. Last but not least, the machine is equipped with an audit trail function. That means the machine records everything. Every status of the machine is recorded. If you switch on, even if you switch off the main switch during a cycle, it is recorded with a timestamp. It's recorded what recipe is used, what user was logged in, what changes they did, and so on. And on the other hand, we have the process data, which will on every cycle we record temperature, the actual temperature of the sealing bars, force, time, and pressure, and some other additional features you might need for your statistics. Lloyd, next page, please. Well, no, sorry, but I forgot to mention that this machine is, this machine is usually used in applications where you have, it's very versatile. If you change your product, you just need another bag. You could take another bigger bag, a smaller bag, and put it in the machine. Capacity-wise, it depends on the product sizes, but we say roughly up to 1 million pieces per year is about the right machine to use. If it's higher volume, higher capacity required, also bigger lot numbers, less changeover, then it will be the next type of machine. Like next page, thank you. That's a thermoforming machine. This machine forms or makes the pocket from a film, from a material. It could be like here, it's a PAPE. Then you could have the top film or closing film using a Tyvek, or again PAP and doing a vacuum pack, or you do a soft blister with PAP and a top layer of paper, for example, or hard blister, of course, if you use PETGE to make nice and hard blisters. Of course, this machine also complies with all the regulatory requirements in all, literally everywhere. Again, very powerful, high speed, same thing as the other machines. This machine actually is quite modular. It can be, we have a lot of different web width and also index length. So actually the machines are configured according to the customer's product needs, size of the product, capacity requirement, and so on. So these are always individual. Yeah, I'm sorry. You see that I'm talking a bit long about the machine. We are a machine manufacturer. That's our passion. That's where we come from. But ever since we built machines, we understood that our customers are not so much interested in the machines as we are. They need a solution, a packaging solution. So ever since we sold packaging machines, we also distributed the packaging material, very focused on the material going onto or being used on our machines. And in the medical industry, of course, with the regular requirement, this has a much more, is much more important. Lloyd, next slide, please. So now I come to the actual quintessence of my little speech here is this validated process from one source. So you have on the outside we have a qualified machine, which I just explained. Then we supply validated packaging material. This packaging material comes from our partner VP Medical Packaging, with where my colleague Dr. Browns will shortly after my short speech continue to explain you. The material we did a state-of-the-art material validation on our machines. We did extensive testing. We did I say worst case scenarios regarding sterilization as well. So we went into that packaging pre-validation with three packaging materials. It's Tyvek, paper film, and PA/PE. All of them we are able now to provide a 10-year shelf life, with the paperwork according or required according to from the notified bodies in order to prove that validation. So we adopt once if you decide for the complete process, we deliver the machine, the material, and the adoption of the validation. This validation, by the way, is of course including the sterilization methods for PAP, as it is a gas type barrier, of course, only gamma radiation, but the other material, Tyvek and paper film, we have both EO and gamma, including as part of our validation. So to summarize it up or sum it up, our packaging validation gives you a solid basis to meet all the new requirements from the regulatory bodies or the notified bodies. Well, but of course, you can also use a machine standalone without the process, or you can also source the material on its own and use it for other applications. And of course, you could also use a logistics service from Mentor Media, independent from that whole process from one source. But I wanted to mention or stress that out, that we're still all offers work independently, but it makes not, of course, it makes a lot of sense according to the new regulation to use the whole process from one source. This is, well, thank you very well. Actually, I'm looking forward to meet you all. I will be personally present at the medical fair in Asia very soon. I'm looking forward to meet some of you in our booth, and it makes it a lot easier for me to show you, include with the machine, the benefits of such a packaging, and also the way you can save time and money in terms of ready to go to market if you have to pack some new product in a sterile environment. Thank you very much for your attention, and I'm happy to pass on to Dr. Andreas Brans, who will get you some more details about the packaging material.
Okay, thank you.
Over to you, Dr. Brands.
Can you hear me?
Yes,
Sorry.
very well.
Yes. Okay. Thank you, Uriel. Good afternoon, good morning, everybody. My name is Andreas Brandt, and I'm the head of the VP Medical Packaging. I have experience of 30 years of experience in medical packaging and in the medical device industry. Thank you for having the opportunity today to give you an overview about VP Medical Packaging. Like VC 999, VP is a family-owned company and was founded in 1896. So we have last year we have the anniversary of 125 years. So that is a lot of experience about packaging in general and also in medical. We started this medical 50 years ago, this medical packaging 50 years ago. And today we employed 800 people at VP, and we produce packaging materials at 5 production sites in Europe. I have to mention that all the medical packaging materials we produce are made in Germany, in Bavaria, and that is maybe important to give you the safety that our products are on a very high level of quality. Our turnover of the group is about 150 million euros, and we shipped our product today in 70 countries to more or less 8,000 customers worldwide. For us, it's our goal and aim is to meet the highest standards in all countries of the world and provide the best possible quality with our innovative packaging solution in medical. Next, please. Innovation and safely packed, that is what we are doing. Today, we supply our customers with large volumes. It means big quantities, million pouches or running meters, and also we offer customized solutions for medical products to our customers. So it's a huge range what we are doing today, so we can fulfill more or less all wishes in the medical packaging industry. Also, we have a large assortment here in Germany and do direct marketing to the hospitals worldwide. It means our customers are in the industrial business and also at the hospitals here in Europe, in Asia or in South America. So both the industrial part of our business and also the business with the hospitals, it's our core business in medical packaging. What we are doing in addition to our huge range of medical pouches and reels, that is a business we have together with VC 999 and Mentor Media. That is a huge part of our business. We offer a full range of coated rolls of different materials for automatic packaging. Both the business of pouches and reels and also the business with thermoformed packaging. It's very important. Are our core materials and core business in our business. What we are doing, and that is maybe a little bit the difference to other suppliers to the medical market, is that we try to find out what kind of material combination the variety we are using today is film, standard film, styrenic of the company DuPont, non-woven materials, or aluminum, foil, and paper. All these different materials we are using or we use for safe packaging of to package your products, and that is a very important aspect in our business, that we start a discussion with our customers to find out what is the best solution due to the material question of materials, and also in combination with your machines, what kind of machines you have and what kind of product you have you want to pack, and also what kind of sterilization process is behind your packing. That is what we are doing, and again, innovation and safely packed. That is the business we do for 50 years. BP is based in Germany, and that's and one of Europe's leading manufacturers and reliable and innovative packaging solutions. We have many standard products in our portfolio, and that is one. On the other side, normally we start our business with our customers with a discussion what kind of product, what kind of machines, what kind of material they want or they like to have for the packaging. So that means we offer sterile barrier systems and packaging solutions for medical device manufacturers, and also to the pharmaceutical industry. Both the medical device industry and the pharmaceutical industry are our customers today. We have a lot of brands, big customers, big players worldwide as customers, and our experience and our knowledge is coming from these customers, and we learned a lot over 50 years with them, and to start or to develop every year new products. Also, the requirements of national and international or European standards and laws for medical products form the basis of the development and manufacture of our products. We have to fulfill all the requirements, and that is what we know, and that is a worldwide demand today, and we can do it, and we learned a lot about that, and we can do it. A big or a very important step in our production was years ago, 10 years ago maybe, that we started the production according to the ISO 13485, and we produce under defined clean room conditions all our products. Clean room condition means we have the ISO 7 clean room and also the ISO 8. It depends what kind of products we have or our customer have to pack. Our highest level today is the clean room ISO 7. Again, innovation is an essential part of what we do. We know standard products are very important, but also to bring more new ideas into the market. That is what we like to do and what we do every day, every week, every month. Next slide, please. Why we can do it? The good thing at BP is that we have our own development. We develop our own films. We develop together with suppliers, sometimes by ourselves, new materials, so that we can say our own development department guarantees individual and customer-specific packaging solutions. So, and everything it's made under the rules and the regulations in the medical business. Our core business, and that is what you can see on the slide, is system solutions, discussion with the customer from the beginning of a new project until the end. We have all the material combination for the form fill packaging, and also we do a lot of business with flat packaging. That means we have a paper to paper or paper to film business as well, or as a product. Pouches and reels, and that is our joint business with VC 999 and Mentor Media. That means we are an expert for pouches. We sell this material to hospitals worldwide and also to our industrial customers. What we can do, we can take, or we can supply you with our stock articles. That means it's a Sterile Clean. It's our brand for pouches and reels, but we can do all the pouches and reels as a customized product. That means when you need a special print on the material, or you need a special material combination, then VP is a good address to contact us. Next slide, please. As you know, a lot of things are to consider when we speak about safety and quality. Safety is, or the patient safety is our prioritized objective in everything we do. So we know that we have to do constant examination and documentation verification of all our products. And that means for your safety as our customer and also for the patient in hospitals. Product and use material conform to the ISO 11607 Part 1. Manufacturing process for seal seams is validated according to the ISO 11607 Part 2. Production under defined clean room conditions, constantly clean room qualification based on the ISO 14644 Part 1 and 3. Microbial examination of our products by an accredited test laboratory according to ISO 11737 Part 1, and also the microbial contamination is supervised and is subject to our monitoring. This is very important to do all these, or to consider all the demands, requirements due to the ISO norms, and that is what we're doing sometimes by us. Sometimes we have external labs, they do the monitoring and give us the information that everything works well. Used material are physiological, non-hazardous examination of cytotoxicity based on ISO 10993 Part 5. Manufacturing of our product according to the GMP guideline 1 and 2. Especially our pharmaceutical customers demand some special activities, or they want to see and they want to have that VP produce due to the rules of pharmaceutical business as well. Okay, you can see the ISOs. That is very, very important for us. And from the beginning, VP Medical Packaging was one of the leaders to introduce all the ISOs in our business and to fulfill all the demands and requirements. Next slide, please. Again, when we think about ourselves, sometimes we are in a hospital, or yes, we have an illness, or we have to go to the doctors, then everybody knows that patient safety is the most important priority, and that's the reason why we say patient safety is our priority. The good thing is the combined experience, let me say, professional with more than 50 years in medical device packaging, also compliance and global supply chain solution. We can say we provide the best in-class solutions through our partnerships. And that is the reason why we are sitting together today. And we want to help all our customers with our partnership, Multimedia, VC999, and VP Medical Packaging, to have the best solution for your packaging in the world. Next slide, please.
So thank you very much, Dr. Brands and Ura, for the presentation. I think we are left with some time for the Q&A. So in the essence of the alliance, we work on a fundamental based on our global outreach, our matrix certification, just-in-time production, and our state-of-the-art quality management system. So today, we actually have a booth in the medical fair, Singapore Medical Fair Asia, 31st of August to 2nd of September. So these 3 days, it will be in MBS. Our booth is in 2Q10. So if you have any questions, you will look at the demo of how the machine works, feel the quality of the medical packaging. Then we can actually be there to guide you through and answer some of your questions that you have. I have seen some of the Q&A asking for machine catalogs and so much so forth. Well, if you have registered yourself with the medical fair, feel free to drop by our booth, 2Q10 again. Representatives from VP Medical Packaging and VC999 will all be there to answer your queries. All right, let us right now open up the floor for questions and answers, and we'll try to answer you guys based on that.
Thank you, Loy. So as Loy has mentioned, we are taking questions. If you have questions, please feel free to submit via the Q&A button at the bottom of the screen.
Yeah.
So while we wait for the questions to come in, let me also share our screen. As Loy has mentioned, the exhibition will take place from 31st August to 2nd September. So you'll get to meet all 3 companies on the show floor. So if you have not registered your visit, please do so as soon as you can. Scan this QR code here and it will bring you to our registration page where you can complete the registration and get a login immediately. You can in fact already start interacting with them on our virtual edition platform. It has already been live. So you will be able to already view their products online, connect with them, schedule a meeting to see them on site, and from 31st August to 2nd September. We also have more webinars coming up in the next 2 weeks. So please register for them as well if you'd like to attend more sessions with more interesting topics. So the next one will be on 11th of August, next Thursday, and we'll have a final one on the 17th of August, which is a Wednesday. So let us take a look if there are any questions. Okay, seems like the questions have been answered. So if there are no questions, then that's all we have for today. Thank you all our speakers for your time. Thank you to the audience as well for joining us today. We look forward to seeing you on the show floor at the end of this month. Thank you and goodbye.
Thank you.